Dr. Bob here again, and one more installment. I hate jumping ahead of myself. I really wanted to cover chronic disease and go over all of the various diseases and get your head wrapped around what's going on kind of at the macroscopic and even at the molecular level when appropriate. And I will do that. But with this coronavirus going around and my promoting, a simple thing that we can do, which is omega-3 fish oils, I wanted to kind of jump ahead and talk a little bit about omega fatty acids because I think it's an area people don't understand. And though I think it could have an impact on how the coronavirus affects you if you get it, there's certainly way more things that it can have an impact on, and I'm going to share a bunch of those with you. Pretty rapid fire fashion. I'm not going to try to drag this out super long. At some point, I'm going to go much more in depth to omega-3 fatty acids. And you could read about stuff I've written about it if you go to Facebook and search wellness patients and join the group, because I've got all the way halfway through exercise on my whole lecture series done in written fashion. Okay, so anyways, the disease model doctors are constantly poo-pooing the benefit of fish oil. Again, profit-driven model, pharmaceutical industry, ignore reasonable data, ignore biological plausibility, look for difficult to obtain statistical analysis that proves a concept, and be damned everything else if you can't prove evidence-based medicine says it's going to make you live longer or reduce heart disease. But you can't ignore stuff forever, and this was a study that actually showed event reduction with a pharmaceutical grade fish oil that was pure EPA. So fish oil generally you want to be made up of almost all EPA and DHA. This pure EPA, where they finally used adequate volumes. Now they use this in a really high risk group, and this was actually came to me as a CME thing from Medscape, and it was the quote hottest topic in cardiology. This let's use fish oil now after we've poo-pooed it forever. And what they showed from this Reduce It trial, they were looking at people with really bad triglycerides that were already on statins, and they put them on this high dose EPA, pure EPA, pharmaceutical grade, and they showed a marked event reduction, and that's what these two graphs show. In the treatment group, double-blind clinical controlled trial, 25% less heart attacks, okay? That got their attention. So now it's recommended if you meet certain criteria, really high triglycerides, you're on maximum statin therapy, that you get on these prescription EPAs. Unfortunately, I tried putting one of my patients that met those criteria on it, and after insurance paid, it was still $300 a month. The high quality, molecularly distilled, independent third-party tested combination fish oils are considerably less expensive than that, and he's still on those at my recommendation. One of the things they pointed out in this presentation was avoiding over-the-counter omega-3 fatty acids. They basically threw all of them into that group. They showed that they can be oxidized versus the pure omega-3 prescriptions. Key issues, lack of regulatory oversight. That's why you have to get a company that does independent third-party testing voluntarily, okay? Batch-to-batch variations are among marketing products. Again, independent third-party tested. They generally test batches routinely. Contain mixtures of fatty acids that may include impurities, saturated fat, cholesterol, oxidated products. Highly concentrated. Remember, almost all DHA and EPA, like, for example, the Synergenics formulation is. Okay, so my takeaways from this study when I got done reading it, it was a good study. I enjoyed reading it. There were better outcomes in the United States patients because they had lower EPA to begin with. I'm going to share some slides that show you that in a little bit. As usual, they lumped all the over-the-counter together, but the talking heads point out that most over-the-counter studies use 1 gram, and it's not enough to show efficacy. The Evaporate trial proposed that the mechanism was it lowers triglycerides. We know that fish oil lowers triglycerides, reduces inflammation. I think that's pretty well substantiated. Stabilizes membranes, so there was less arrhythmia and decreased sudden cardiac death. Probably reduces thrombosis. Fish oil has a bit of a blood thinning effect. Plaque reduction in the treatment group by CT angiography at 9 months. Now that's significant. They looked at people's coronary arteries and there was plaque reduction. I mean, this is a pretty big deal. The Strength trial is a pending trial that actually, as of now, has been terminated. Unfortunately, again, this was a trial where they looked at pharmaceutical grade EPA, DHA in a high dose, because they always use too low a dose when they examine the efficacy in reducing heart disease. And what they showed was that there was not the data hasn't come out, but apparently it didn't meet statistical significant reduction. So the company didn't want to keep spending the money because, again, you had a pharmaceutical industry making a prescription fish oil that they were hoping insurance was going to have to pay for. And so they canned it. Now, everybody in the study was on a statin. And one of the benefits of fish oil is probably that it helps reduce plaque instability, which is one of the things that statins do. So you may not see much of an effect in somebody who's on a statin. What about if we did a 4-gram study on people not on statins? That's what I want to know. One thing they did point out, no side effects, minor increased bleeding without serious or fatal bleeding. It's as safe as placebo. All right, so, well, what's some other stuff? Okay, I'm just going to rip through these. Omega-3, polyunsaturated fatty acid supplementation, and the prevention of clinical cardiovascular disease. This is American Heart Association Science Advisory. The big points were recommendation for patients with prevalent coronary heart disease, such as recurrent heart attack, remains essentially unchanged. Treatment with omega-3 polyunsaturated fatty acids supplementation is reasonable for these patients. Modest reduction in coronary heart disease mortality, 10%. All right. And they plead for more randomized controls trials. Association of omega-3 fatty acid supplementation use with cardiovascular disease risk meta-analysis of 10 trials involving 77,000 patients. No support for the 1 gram per day omega-3 fatty acid. That's what you see all the patients come in on, is a gram of Vasa, which is a prescription combination omega-3 fatty acid. It's not enough. You'll see from what I'm showing as far as our dosages, to get people to the level that I think you need to be at, you need about 4 to 6 grams a day. They did point out ongoing trials are needed to assess higher doses of omega-3 fatty acids. 3 to 4 grams a day may have significant effects on risk of major cardiovascular events. Further down, use of supplemental long-chain omega-3 fatty acids and risk of cardiac death, and updated meta-analysis and review of research gaps. Okay, this one showed that modest but statistically significant benefit of long-chain omega-3 supplementation on risk for cardiac death, 8% in the primary analysis. Support the recent science advisory from the American Heart Association. Low risk for adverse effects. Subgroup analysis shows numerically larger benefits in studies that used 1 gram per day and higher risk groups. So in other words, yeah, like you might expect, the higher risk you are, probably a larger benefit. I'll take an 8% reduction in cardiovascular risk. Additional research is warranted. All right. A meta-analysis of randomized controlled trials and prospective cohort studies of EPA and DHA on coronary heart disease. Non-statistically significant reduction in coronary heart disease risk with EPA, DHA. Statistically significant coronary heart disease risk reduction among higher risk populations, including participants with elevated triglyceride levels, elevated low density lipoprotein cholesterol. Conclusion, EPA DHA may be associated with reducing coronary heart disease risk. And that was Mayo Clinic. Okay, so essential fatty acids and inflammation. Inflammation is one component of the body's immune response to injury and illness, and when functioning properly, assists in the restoration of health. Inflammation occurs at the cellular level, precisely where our bodies store and release essential fatty acids. Some essential fatty acids, such as omega-6 fats, facilitate a pro-inflammatory response. Others, like omega-3s, have an anti-inflammatory response, counteracting the actions of omega-6. The reaction is dependent on a variety of external stimuli that we encounter and the different types of essential fatty acids in our body. This is kind of a diagram that shows that inflammation is part of the predicament that results in clogging of the arteries, okay? When the blood vessel wall is inflamed, as you might expect in somebody with a poor omega balance, the walls become leaky. Small, dense, oxidized cholesterol particles start to wedge in, macrophages move in and oxidize them further, and they turn into these plaques, which can eventually rupture, block off the blood vessel, and cause anything downstream to die. This is the process that's going on at the microvascular level, causing dementia, kidney failure, retinopathy, osteoporosis, loss of muscle mass. Our vessels are clogging off and we're dying, okay? At the macroscopic level, when big arteries get blocked off, you get a heart attack, you get a stroke. This is what gets 60% of us, people, okay? And I believe fish oil can help reduce this if you take a high quality one. Omega-3 fatty acids include EPA and DHA. Those are in your fish oil, and ALA, that's your vegetable omega-3. And they have an anti-inflammatory effect. Conversely, omega-6 fatty acid, arachidonic acid, and others are converted into icosanoids that have powerful inflammatory effects. And this is a diagram taken from Bill Land's research. He knows a lot about omega-3s. And what he showed was that there was a tendency for populations with high coronary heart disease, the grain belt, United States, Quebec, okay, to have low percentage of omega-3s in their cell walls of their total score of highly unsaturated fatty acids. And as coronary heart disease declined in populations, you tended to see an improvement in the percentage of fatty acids in their cell walls that were omega-3s. And an interesting one is when they looked at Quebec Cree, which are inland Indians, and Quebec Inuit, which are Eskimos. And even within that, you can figure probably fairly similar genetics. The increase in fatty acid intake in the omega-3 category resulted in improvement in cardiovascular heart disease outcomes. Doesn't prove causation, but straight lines usually mean anything. And personally, I think if you want your percentage of omega-3s to be here, you're not very bright. Here was another study, part of the research, that showed that there is and I mentioned this in that earlier study, the talking heads about the triglycerides and the membrane stabilization. Risk of primary cardiac arrest, where you go into ventricular fibrillation, based on red blood cell, EPA, and DHA. This is something that I test on myself and some of my patients when they want to. And what it showed was if you can get your total level of EPA and DHA in your cell membranes up above 8%, there's a 90% reduction in risk, okay, of sudden cardiac death. Before we go into this, I'm going to share my study with you. This is on my Synergenics fish oil. It's like I did this in May of 2017. Now my total omega score is 10, with the average US at 4. My percentage of omega-3s, 57, average US 24. My omega-6, omega-3 ratio, 3 to 1, average American 8 to 1. Arachidonic acid, the really bad actor, to EPA, 1.5 compared to 18.3. Total omega-6 scores tend to be lower than average Americans in all categories. My omega-6 is based on my diet, my other intake of omega-6s through my diet. I avoid foods that are high in omega-6s like corn oil and such and grain. Now, here's where I came out down here close to Japan on the 57 percentile. More importantly, total omega score, remember the average US is here, risk of sudden death. My total omega score is way out on the end of the thing. All right, so it must be genetics, right? Oh, well, hang on. You can see that I cross all the lines where I want to be. My EPA is above the line. My DHA is above the line. Total omega is above the target. My omega-3 index is well above the target. And here where I want to be below the line, arachidonic acid to EPA and omega-6 to omega-3 ratio is well below the line. So good to go there. All right, it's all genetic, right? Well, my sister's given me permission to share with you her data. Okay, so before I started taking care of her, I managed to get a sample of her blood. Now, she's not an unhealthy person. In fact, I think she came in 6th in her decade for cross-country skiing in the Anchorage women's race a few years ago. She's thin, athletic, eats a relatively healthy diet, probably too much grain. Doesn't eat a whole lot of fish because her husband doesn't really like fish, which is unfortunate because we live in Alaska, although we'll eat halibut. So, look it, she's right there with, well, actually a little bit below American average for total score. So she's in the risk for sudden cardiac death if she has a heart attack. Her percentage, 25%, a little bit higher. Omega-6, 75%. Omega-6 to ratio, a little bit higher. Arachidonic acid to EPA, a little bit below. So she's not eating a ton of, probably grain-fed, overly cooked meats. She didn't make any of the targets here for her good omega-3s. And her total omega-6 score was a little elevated, although arachidonic acid was below other people in the population. And you can see that she came in here with the US in terms of percentage, and her total score was mid-yellow. So, and you can see she's below the target ranges on these and above the target ranges on those. Okay, so probably we share similar genetics. Does that prove that it's genetic? Well, let's see what happens when I put her on fish oil. Whoa, here we go. 10.5. 56, 44, ratio 3.5, kind of like mine now. Look at her arachidonic, 1.9. Looks like you can change the composition of your cell walls. Remember, we're molecules, and the hole that controls the molecules is right there. Now all of her scores are optimized. ALA, which is vegetable, above American controls. EPA, made it. DPA, made it. DHA, made it. Now the ratios are lower than Americans. Arachidonic acid now is even lower. Everything looks good. And she's out. She made it past the target, above 50%. And instead of being at the average US of 4.8%, she's now way out here on the don't have sudden death. Okay, so I'm telling you, I think from a cardiovascular standpoint, omega-3 fish oil makes sense. Let's go back to my slideshow. Here we go. So what's going on here? Well, here's another little thing I like to point out. This is a diagram of your omega-6 rich foods again, taken from some of Bill Land's research, and omega-3 rich foods, okay? And of course, you see the fish there, vegetables, certain beans, cucumbers, kiwi fruit. Healthy foods are rich in omega-3, particularly ALA in your vegetable foods. Chia seeds, great source. Also hemp seeds and flax seeds for your ALA. And then fish is the best source for your DHA and EPA. But what you see is these EPA converted by an enzyme called the cyclooxygenase enzyme to anti-inflammatory prostaglandins and leukotrienes, and you see kumbaya and you're out playing sports, right? All these foods rich in omega-6s, on the other hand, result in leukotrienes and prostaglandins that cause inflammation, chronic pain, headache, and pro-inflammatory. All right, now, this cyclooxygen enzyme is important in that it is the enzyme that is attacked or blockaded by your anti-inflammatories. So if you live way over on this side of the cell wall composition, ibuprofen is probably going to help treat some of these symptoms. But you might have heard that ibuprofen seems to be a risk factor for bad outcome with this coronavirus. Well, you need these too. And when you take ibuprofen, you block the enzymatic conversion. So you're not getting these healthy anti-inflammatory prostaglandins and leukotrienes. And it must be important in this coronavirus thing. And here's the point. This is a study called The Risk of Acute Myocardial Infarction, that's a heart attack, with NSAIDs in real-world use, a Bayesian meta-analysis of individual patient data. Now, this study was massive. I'm just going to hit the high point. Oral nonsteroidal anti-inflammatory drugs increase the risk of acute myocardial infarction. I do not prescribe NSAIDs for anybody over 40 in the ER setting. Tylenol is the over-the-counter pain medicine now, from my perspective. The time course for risk of acute myocardial infarction and the effects of dose and duration of continuous use for the main NSAIDs. Risk of myocardial infarction associated with NSAID use increases immediately with exposure. Relation between increasing NSAID and daily dose and risk for acute myocardial infarction. Longer duration of treatment generally does not seem to be associated with greater probabilities of increased risk. It's because you probably already have exposed yourself, and if you're not at an increased risk, if you're not about to thrombose, then staying on it's probably not increasing your risk. NSAIDs exhibited a rapid onset of risk for myocardial infarction in the first week of use. 8 to 30 days at a high dose was particularly harmful. Okay? Advil may not be that great of an idea. I don't take it ever anymore. I'm done with it. Okay, so let's see. I'm just going to rip through these now. Serial circulating omega-3 polyunsaturated fatty acids, healthy aging among older adults in the cardiovascular health study, a prospective cohort study. I'm going to just go to the results here. Here's what we see. Higher levels of long-chain N3 PUFAs were associated with an 18% lower risk, 95th percent confidence interval, 7 to 28% of unhealthy aging per interquintile. So basically, every time you went up in a quintile of higher polyunsaturated fatty acids, your risk of unhealthy aging was reduced on average 18%. All right, here's another one. Effects of supplemental fish oil on resting metabolic rate, body composition, and salivary cortisol in healthy adults. Conclusion, 6 weeks of supplementation with fish oil significantly increased lean mass and decreased fat mass. These changes were significantly correlated with a reduction in salivary cortisol following fish oil treatment. it does more than just treat heart disease. Here's another one. Randomized trial of weight loss diets for young adults varying in fish and fish oil content. Conclusion: in young, overweight men, the inclusion of either lean or fatty fish or fish oil as part of an energy-restricted diet resulted in approximately 1 kilogram more weight loss after 4 weeks than did a similar diet without seafood or supplementation of marine origin. The addition of seafood to a nutritionally balanced, energy-restricted diet may boost weight loss. We all would like to be a little thinner. Omega-3 fatty acid supplementation for 12 weeks increases resting and exercise metabolic rate in healthy, community-dwelling older females. Long-chain N3 polyunsaturated fatty acids reduce adipose tissue and systemic inflammation in severely obese, non-diabetic patients. Randomized controlled trial. Conclusions: treatment with long-chain N3 polyunsaturated fatty acids favorably modulated adipose tissue and systemic inflammation in severely obese, non-diabetic patients and improved lipid metabolism. These effects may be beneficial in the long-term treatment of obesity. Clinical benefits of N3 polyunsaturated fatty acids and alpha-linoleic acid, that's the ALA vegetable, in patients with rheumatoid arthritis. This is interesting. Daily supplementation with N3 fatty acids alone or in combination with GLA exerted significant clinical benefits and certain changes in disease activity. I found a study, and I couldn't find it again, where they showed that a gram of fish oil a day was as effective as 800 milligrams of ibuprofen 3 times a day for people with rheumatoid arthritis in terms of pain scores. Lipid correlates of antidepressant response to omega-3 polyunsaturated fatty acid supplementation, a pilot study. Antidepressant. 5 patients, depressive symptoms improved after supplementation. 5 patients showed a decrease of greater than 50% on the 17-item Hamilton Depression Rating. Not only responders, but met standard criteria for remission. So they didn't just respond, it remitted their depression. Your brain's made up of fat, and if you make it up of the healthy fats that you were supposed to be made of, it'll probably work a little better. Omega-3/6 fatty acids for reading in children. Randomized, double-blind, placebo-controlled trial in 9-year-old mainstream school children in Sweden. 3-month parallel randomized double-blind. Conclusion: 3 months of omega-3/6 treatment improved reading ability. In particular, children with attention problems showed treatment benefits. All my kids take fish oil, by the way. Omega-3 polyunsaturated fatty acids in use with attention deficit hyperactivity disorder, systematic review and meta-analysis of clinical trials and biological studies. Here you go. In summary, there's evidence that N3 polyunsaturated fatty acid supplementation monotherapy improves clinical symptoms and cognitive performance in children and adolescents with ADHD, and that these youth have a deficiency in N3 polyunsaturated fatty acid levels. It turns out quality of outcome and diet are closely linked. Omega-3 in vision. The retina of the eye is the highest concentration of omega-3 fatty acids in the body. A growing body of scientific evidence suggests the pathogenesis of diabetic retinopathy, which includes swelling of the blood vessels that leak fluid or grow abnormally on the surface of the retina, may be strongly associated with oxidation and inflammation. Research on omega-3s and diabetic retinopathy. Data from both clinical investigations and experimental studies suggest an overall protective effect of long-chain polyunsaturated fatty acids on ocular inflammation and vascular eye disease. DHA acid and adult memory, a systemic review and meta-analysis. DHA alone or in combination with EPA contributes to improved memory function in older adults with mild memory complaints. quantitative erythrocyte omega-3, EPA, and DHA levels are related to higher regional cerebral blood flow on brain SPECT. That means improved blood flow to the squash, probably a good thing. Quantitative omega-3, EPA, and DHA erythrocyte concentrations, that's what I measure in those diagrams I was showing you, are independently correlated with brain perfusion on SPECT imaging and neurocognitive tests. These results have implications for the role of omega-3 fatty acids toward contributing to cognitive reserve. All right. Hey, I got one more thing for you. Right here. Nutrients. You can Google this. The influence of dietary fatty acids on immune responses. This is, it was a free PDF. I'll go ahead and put it on my Facebook Wellness Patients page if you want to go there and grab it. It's pretty scientific mumbo jumbo, but it covers it all. It helps you understand omega and fatty acids in general, dietary fatty acids and immune response. There was one good cartoon I really liked. I think it was pretty easy to understand. Getting there. There you go. So here we look at inflammation and inflammation with N3 polyunsaturated fatty acid supplementation. We were talking about that in my diagram where I showed you how inflammation is a major effect on permeability and leaking all this fluid, which is this terrible cascade that results in your lungs filling up with fluid and you ended up needing to be on a ventilator. So, inflammation, the cell wall, increase in barrier permeability, increase in mucus production, pro-inflammatory cytokine production, the cytokine storm, oxidative stress, decrease in the tight junctions here along the cell walls of the blood vessel, and decreased healing. Supplementation. Decreased barrier permeability, decreased mucus production, decreased pro-inflammatory cytokine production, decreased oxidative stress, improvements in the tight junctions, and improvements in healing. It's a nice article. It's well written. I like the Nutrient magazine. It's 2019 summary. Like I said, it's pretty scientific mumbo jumbo, but if you wanted to kind of read through it and see what you could understand, you might find it benefit. All right, so that's why I think omega-3 supplementation is important. Is it important to try to reduce your omega-6 intake? Yeah. Should you try to get as much omega-3s from your diet as possible? Yes. Is it reasonable to eat fatty fish? Yeah, I eat a ton of salmon. I try to do so at least once a week, more when I'm out of town, so my family doesn't like it as much as I do. But the fastest way to shift that balance, like I showed in myself, like I showed in my sister, is to get on a high quality, molecularly distilled, highly concentrated omega-3 fish oil that's independent, third-party tested, so you know that you're getting what they're actually saying. All right, we'll talk to you later.